All right, we've got 5 slides for this section, anemia caused by blood loss. So what kind of blood loss? We've got acute blood loss and we've got chronic blood loss. So acute blood loss occurs as a result of sudden hemorrhage. So what would this be? This would be trauma, complications of surgery, or conditions or diseases that disrupt vascular integrity, right? So the problem with acute blood loss, a sudden reduction of blood volume leads to hypovolemic shock. If the loss is gradual, then the body can maintain and compensate. But we're talking, so we're still talking about if the patient is under trauma or complications of surgery and it's acute blood loss. If that's if it's a slower if it's a slower loss, then the body can start to compensate. So if we're looking at the volume lost, it's directly related to their clinical manifestations. So somebody who has about 30% loss, this person might start to develop some tachycardia. Further loss indicates their blood pressure, their cardiac output starting to decrease, and then of course 50% volume loss, shock, and potential death. So your diagnosis, well, obviously if you're seeing the acute blood loss or the hemorrhage, then you can, for example, if it's trauma, then you know exactly what it's being caused from and you can treat it. If there is trauma, you're not waiting for the hemoglobin and hematocrit to understand how much blood loss there is. You're actually just going to go ahead and replace the blood volume, or you're doing IV fluids, volume expanders such as crystalloid or lactated ringers to replace that volume. Supplemental iron if the blood loss, if you can determine that it's if you can determine that it is from some iron. Excuse me. Chronic blood loss, so sources similar to those of iron deficiency anemia. So with chronic blood loss, the body can compensate, and so you might find that the patient may be able to function fine with a low hemoglobin hematocrit, just because the body's been able to compensate in another way. So with chronic blood loss, if it's due to depletion of iron stores, it's considered an iron deficiency anemia. If it's due to bleeding ulcers, hemorrhoids, menstrual, postmenstrual blood loss, the blood might still look normal. It's just a low volume. So with the blood counts, you'll be seeing hemoglobin hematocrit decrease. You might be seeing the iron decreasing, the total iron binding capacity decreasing. Now, of course, though, the treatment is to identify the source, stop the bleeding, and the supplemental iron to help with that. Actually, we just have 4 slides for that because that's the last slide. We're going to talk about in another section.